There is new medical information showing there's a link between coronavirus and stroke patients. KPAX's Marin Sue spoke with a neurologist who explains what causes this.
Fever, chills, and upper respiratory issues are all symptoms of coronavirus. However, new medical studies suggest stroke is another.
With the new reports coming out of New York and that have been confirmed by some sites in Europe and LA as well, that we're seeing big stroke in young people, which is very unusual. And it can be their initial presenting symptom of coronavirus.
Dr. Kurt Lindsay, neurologist at Kalispell Regional Hospital, says this surprising connection between stroke patients and coronavirus is presenting in patients under 60.
We're seeing stroke in people in their 30s being reported, and that's really unheard of.
He says in these cases, stroke symptoms like partial paralysis, dizziness, and trouble communicating can come on suddenly and with none of the traditional coronavirus symptoms. He says through scientific studies, coronavirus is known to excessively clot blood.
A disease that causes blood clots, you can potentially have those blood clots go to the brain and cause stroke.
Dr. Lindsay says the medical field is still learning more about the relationship between the virus and stroke. While no one in the Flathead Valley has presented these symptoms, he says if you have symptoms of a stroke, get to the hospital immediately.
We're seeing our stroke ER visits and hospitalizations down by 70% over the last 2 months. And it's not because people aren't having strokes, it's because they're not going to the hospital.
Dr. Lindsay reminds anyone who is afraid of going to the hospital because of the virus that the hospital is prepared for this and that it is a safe environment. In Whitefish, Marin Sue, MTN News.
And of course, the doctor reminds people coronavirus isn't gone. He'd like everyone to continue to social distance, wash your hands a lot, and wear masks in public to protect others.